The COVID-19 vaccine developed by Pfizer and BioNTech will be available in Britain from next week. India is also looking for the vaccine that would be the most suitable for the country. The one major consideration in picking a vaccine will be affordability, or the cost involved. The current price of a Pfizer dose is $19.50. With 2 doses required for effective vaccination, it would cost $39 per person. The vaccine candidate by Moderna, that is nearing emergency use authorization, is priced around $25 to $37 per dose. It will cost $50 to $74 to vaccinate a person. The two are mRNA vaccines, making them costlier than the traditional ones since they use biochemical and newer technologies. India has to vaccinate a substantial chunk of its 1.4 billion population to deal with COVID-19. Pfizer and Moderna vaccines may not be the most feasible for the country given the cost involved.
For the mRNA not to degrade, requires that the vaccines are kept at minus 80 degrees centigrade, and so this makes it extremely difficult in the Indian condition for covering a large section. The cost of the vaccine is not only the cost of the production, but also the maintaining the chain distribution, all the PPE kits that will be required. It's definitely going to be on the higher side, and therefore the vaccines in the Indian context may not make much difference.
The Indian government is banking on the Oxford AstraZeneca vaccine Covishield being made by the Serum Institute in Pune. Under the COVAX agreement, a global pact of vaccine distribution, the Serum Institute will sell Covishield for $3 per dose. But that price is only for 2 billion doses to be shared by 92 Gavi countries. In a TV interview, Serum's chief executive Adar Poonawalla said the pricing is likely to be around 1,000 rupees per dose outside COVAX. Experts believe that for an effective vaccination program, the country will need a vaccine that will cost under 50 cents or less than 37 rupees per dose. In an interview to the Indian Express, microbiologist Dr. Gagandeep Kang said, and I quote, "We don't have a vaccine as expensive as the AstraZeneca vaccine in our program at the moment, and that's at $3 a dose, the lowest price announced. It still means you need $6 just for the vaccine and more to deliver it in campaign mode. If you're talking $10 per person per set of vaccination, that already makes it the most expensive vaccination program this country has ever had." Government officials have constantly stressed on Bharat Biotech's Covaxin being the most feasible option for the country. Although the vaccine might work out to be cheaper, the wait is likely to be longer. The company started the phase 3 clinical trials only in November, and the company hopes to file for Covaxin approvals by June 2021. US authorities are moving fast to ensure that any FDA-approved vaccine gets covered under government-funded health insurance programs and employer health plans. Such a scheme may not work in India. According to the National Family Health Survey of 2018, less than 1/3 of households in India have at least one usual member covered under health insurance. Only 20% of women aged between 50 to 49 years and 23% of men aged between 50 to 49 years are covered by health insurance or a health scheme. Infrastructure, cold chain, and training might be a big challenge, but India will have to calculate affordability. Harish Upadhyay for the Federal.